Good afternoon, this is Dr. Do again. This video is quarantine special edition, video number 12. Today's topic is on infection, bacterial infection versus viral infection in general, without any kind of disease or where the infection located. Could it be the digestive system, could it be the respiratory tract, but I'm not specify any, just in general compare with bacterial infection to the viral infection, how to identify, what kind of signs telling you have bacterial infection, you need to go see your physician or emergency room, or what kind of signs telling you that it is a viral infection you can manage at home. Because we all know that pretty much the viral infection is self-limited, just take time, symptomatically management. Okay, so basically, let's start from the introduction of bacteria and virus. What a difference. Bacteria is a function unit, like a cell, can have the membrane or wall, depends what kind of bacteria, enclosed with the nucleus, organelles. They can duplicate or replicate by themselves, so live alone by themselves, with a strong capacity, potential to infect. It's like called potent. Okay, the virus, on the other hand, does not like a bacteria can survive or duplicate and replicate by itself. Usually has to be infect the body cell and with the assist from the body protein or organelle, and they continue to replicate and then release. So this is the difference between the bacteria and the virus. Of course, there are different kind of bacteria like a rods, cocci, or different shaped. And the virus also, there's a DNA virus, RNA virus, double strand, single strand, etc., etc. I'm not going to go that details because those belong to the specialist, either molecular biologist or the infectious disease specialist or the physician. But I just give you the general idea, the bacteria and the virus. Okay, so they both can cause the infection. Okay, usually for the bacterial infection, if the symptoms is called toxic. In addition to fever, fatigue, you feel very sick. For example, I'll give you an example. Strep throat, which is a bacterial infection from the streptococcus. And the other upper respiratory infection, like for example, mono, you all heard of these. So both of them are upper respiratory tract infection. You have sore throat for both of them. But for the strep, you feel more sick, toxic. The fever is higher and lasts longer, no coughing. But the mono, you feel pretty much like a viral upper respiratory tract infection. You feel coughing, you feel sore throat, you feel congested. So these are the difference. This is the example. So the same thing as the diarrhea. Bacteria cause diarrhea versus rotavirus cause diarrhea. One is just the diarrhea, rotavirus. You do not feel anything, but just to keep going to have the losing the fluid. But bacteria, on top of that, if bacteria cause diarrhea, usually associated with the fever, and even you have the mucus and the blood in the diarrhea. So that really indicate you have serious infection. On top of that, you have fever, nausea, vomiting, and you feel general toxic and sick. So this is the fundamental difference. And regardless, bacteria or viral, if you're not sure, check it out. Call your physician, either the office or emergency room. For example, you have this fever going on for a couple of days and you're not sure whether you do not feel that sick, but the fever itself makes you feel sick, tired, nausea, vomiting, headaches. You're not sure what you're going to do. You're not going to do like, oh, this is a viral infection, I'm staying at home, managed by myself. If you're not sure, then call your physician. to make sure it is to rule out bacterial infection, and then tell you symptomatic management after the confirmed exclusion. Okay. In addition to that, if you really had a sick contact, for example, if you're working in the daycare or you work in the hospital, you're susceptible to the infections. If you're daycare, pretty much is the viral infection, because the children, there are a lot of virus in the seasonal, especially in the spring, like currently pandemic coronavirus. But if you work in the hospital, you could be virus or could be the bacteria. I'm sure you know it. If you're nursing, medical assistant, of course you know that the physician might tell you. Again, this is just the general knowledge about the infection. Tell you how to identify bacterial infection versus virus from the symptoms. In terms of treatment, of course, you know, for the viral infection, majority of case, we do not need antibiotics, just symptomatically manage. Unless they're complicated bacterial infection, the physician see you and your infection has been going long more than a week and the fever is still there, even though started with virus infection, probably complicated to with the bacterial infection. If that's the case, you need to be treated with antibiotics. For the bacterial infection, like for example strep throat, you went to the clinic, the physician did the swab on the throat and confirmed it's positive, so directly you're going to be on antibiotics. Different physician has different preference. I'm not going to talk which antibiotics to be used. So anyway, in terms of symptom recognize whether it's bacteria or viral, in terms of treatment are totally different. So this is the purpose for this video, quarantine special, to tell you how to identify viral infection versus bacterial infection, and when to call the physician office or when to call the emergency room. Thank you for watching, and I'll see you next time.